Here's a live look at London as an alarming new study is released into the long-term effects of COVID-19. The survey suggests around 2 million people in England suffered lingering effects of the virus beyond 12 weeks. For more on the study, we'll go live now to Tessa Arcilia in London. These are some alarming details. Tessa, walk us through what's in this study.
Yes, indeed. So that 2 million figure that you mentioned here in England, that is actually double previous estimates. So that is what researchers are saying. There's a lot more people out there suffering from the long-term consequences of COVID than initially thought. So in that study that they did in England, of everybody who said that they suffered from COVID, about a third of those people say they suffered symptoms for more than 12 weeks. Now, it's important to note, John, that at this point in time, there is no universal definition of what long COVID actually means. And there's very little we know about this. And I think what is alarming researchers is the kind of symptoms that do last. So they said they divided people broadly into two groups, those that are suffering from chronic fatigue or tiredness. And this can be debilitating, like people just don't know what to do with their tiredness. And those that are suffering from respiratory diseases or symptoms like shortness of breath or difficulty breathing. Now, there is a man here, John, who had suffered from these symptoms for 10 months. And now that is the longest recorded case of COVID in the world, and he said it really affected his quality of life. Take a listen to this.
I had a terrible cough. At one time, I coughed for 5 hours non-stop. I don't mean cough break. I mean cough, 5 hours non-stop. If you can imagine the drain that puts on your body. I looked in the mirror, thought, who's that old man in the mirror? Oh, it's me.
Now, based on the data they've collected so far, John, it seems like what is emerging is that this prevalence of long COVID, of these symptoms, are higher as you get older. So it increases with age. It is higher with women, also people who are overweight or obese, those who smoke, and those who are from less privileged areas, and those who have been admitted to hospital when they were sick. So these are initial data coming out of here, still to be peer-reviewed, John, but very interesting findings, and again, alarming for researchers.
Well, this is the UK promising more money to study the long-term COVID-19 effects. So let's talk about how Canadian doctors and researchers might be able to take away from the results.
Yes, John, apart from funding, I think Canada, it will be interesting for Canada to look at what else is being done, because here in England, there are about 80 so-called COVID assessment centers specifically for people who are trying to mitigate these long-term symptoms. You know, it is so new that nobody really knows what to do with it. And there are also efforts to educate GPs on how to better diagnose this and better treat it. And of course, in the long run, it is something that they really need to understand in order for the health system to be able to deal with it. And Canada has been conducting some studies. I think the latest one is from May, showing that people who are suffering from symptoms that last for more than the usual 14 days, half of them report that these symptoms lasted 11 months, John. That is a long time. Of course, this is still a small sample size, but I think Canada will definitely be looking to the data coming out of the UK as they conduct their own studies. John?
Thanks for this, Tessa. The CBC's Tessa Arcilia, live in London.